had a lot of stories, but one in particular that kind of comes to top of mind, and I'm sure that you remembered as well, as the gentleman, who, like many people we've talked to, go to the VA for everything, and I believe he was 100% P&T, and said, you know what, I don't want Medicare. I'm not going to take it at 65, and makes the decision, I'm just going to go without it. Happy with his care team, happy with everything that was, going on at the VA at that time. And then can you speak to that a little bit? What ended up happening to that individual, and why would a veteran end up maybe having to change that decision down the line they made?
One of the things I want to highlight is that you said at that point in time. They were happy with their healthcare at that point in time. Problem is VA's turnover for healthcare professionals, their staff, it's very, very high, their turnover rate. So it's changing. It's a revolving door in many cases. So while he was happy with it at that point in time, he didn't see any need to have Medicare as a backup. The problem is, years down the road, the PACT Act got passed. Millions of veterans ended up getting access to the VA that didn't have access before.
And that's what the PACT Act did.
It did. Correct. It opened up, exactly. It opened up the VA to veterans that weren't able to get health care there before, veterans that were exposed to toxins and chemicals and all these other issues that weren't recognized before. And that caused an influx into all the VA facilities. And so at his local clinic, the wait time started to get longer and longer. And the problem is as he got older, he's, I believe, about 75 when he came to us to get help, he had been diagnosed with a condition that required him to get health care consistently. Like, he had to go in for treatments almost every week. And with the wait times getting longer and longer, he wasn't able to get in a timely manner. So he had to look at an alternative. And he thought that, well, I'm eligible for Medicare now. He went back and he enrolled. And to his surprise, he ended up getting penalized well over $400 a month.
That was the price he had to pay.
Exactly.
With the penalty included in there. Okay.
Yep. So not only did he have to pay the base premium, he doubled it because he went almost 10 years without that actual Medicare coverage, where he didn't have creditable coverage. And now he's stuck dealing with that for the rest of his life. Why? Because he needs that health care.